Hi, welcome to Dental Canvas. I am Dr. Gopal Kasat, and in this episode, we will be discussing the anatomy of the permanent mandibular lateral incisor. Before going ahead, if you are new to this series, check the description below or refer to the video on the top right corner to learn basic terminologies required for a better understanding of this video. Also, go through the anatomy of the mandibular right central incisor before starting with this, as it resembles the mandibular central incisor so closely that only a brief description of each aspect is required. Now, let us start with the labial surface of the mandibular right lateral incisor. The average length of the crown is 9.5 mm from the cervical line to the incisal edge, which is the same as that of the mandibular central incisor. The distal contact area is more towards the cervical than the mesial contact area. This ensures a proper contact with the mandibular canine. Mandibular lateral incisor is somewhat larger than the mandibular central incisor in mesiodistal direction, with a diameter of 5.5 mm at contact areas and 4 mm at the cervix. The incisal edge of the crown is straight and slopes downward in the distal direction, as the mesial side of the crown is often longer than the distal side. Now let us move on to the root. Length of the root is 14 mm. Other than that, root form is similar to that of the mandibular central incisor, including the presence of developmental depressions mesially and distally. Now, let us move on to the lingual aspect. The cervical line is similar to that of the labial aspect with the curvature root-wise. Just below the cervical line, there is a smooth convexity known as cingulum, followed by a slight concavity known as lingual fossa. Now, let us move on to the mesial aspect. Labiolingual width of the crown is 6.5 mm at the crest of curvature that lies in the cervical 1/3 and is approximately half a millimeter more than that of the mandibular central incisor. Labiolingual width of the crown at cervix is 5.8 mm. The curvature of the cervical line representing the cemento-enamel junction on the mesial surface is 3 mm and is towards the incisal edge. Similarly, from the distal aspect, the curvature of the cervical line is 2 mm and is towards the incisal edge similar to the mesial side. Now, let us move on to the incisal aspect. The incisal aspect is not at approximate right angles to a line bisecting the crown and root labiolingually, as was found when observing the mandibular central incisor. The edge follows the curvature of the mandibular dental arch, which gives the crown of the mandibular lateral incisor the appearance of being slightly twisted on its root base. It is a characteristic of the mandibular lateral incisor and works as a differentiating feature. That completes all the 5 surfaces of the mandibular lateral incisor. To summarize it all, you can see a picture on the screen with all the average dimensions and key features. To download the same and see our resources, check the description. If you have learned something, hit the like button and feel free to subscribe. Looking forward to your comments. Thanks for watching. I am Dr. Gopal and you have been watching Dental Canvas. See you all in the next one.